Now, since this project started, we've already operated more than 4,700. Now, coming to this challenge is because we've seen, after doing all the work, the clinicians in the province are still complaining about the huge surgical backlog. So seemingly we are really not moving. That is when we do some analysis, we are realizing that we are actually spending more resources doing elective operations to mostly illegal immigrants in the country. And this, I remember in the month of June when we were in Chiritini, in a ward of 27 orthopedic cases that were operated, we realized that 19 were foreign nationals. We were at Kukune in the month of July, where we operated 270 cases, and also even in that area. I even met a guy who was saying to me, we got an accident while I was in Harare, and my brother who is here in the country also illegally called me to say there is services. There's a doctor who can be able to help you. She usually brings specialists. Now, this is an abuse of a program that we have initiated as a province, appreciating our challenges to provide quality healthcare services to the people. Now, we started at George Masebe. We met other illegal immigrants. We moved to, I'm not sure why that side they didn't take the videos. We moved to Vila Hospital, where clinicians were raising these problems with me. As a political head of the department, it's my responsibility to do what my doctors cannot do. They are overwhelmed, they cannot cope. We were having a conversation with the patient and explaining to them how budget works and how we are saying they need to pay, because that's what the constitution of this country is saying. Put yourself in our shoes as provinces that are overwhelmed, having to deal with all these illegal immigrants. Elective operations, it is not our responsibility to do that. However, as a province, we are operating you, but we are saying, let's pay. The challenge we're having is those who are illegal, whom we cannot account for, and that they are supposed to pay full. But because we don't have any documentations from them, we are forced to assist them, and they leave without even paying. You see, when anyone who is in the country needs emergency services, we will not deny the person. In this case, we are saying to do those elective procedures, some of them are coming just to be done hysterectomies. It is costing us a lot of money. Orthopedics cases that were done there, they could cost between 70 and 200,000 each. Now, when you operate 5 of those, it's already $1 million. The budget that I was saying we don't even have as a province. We reach a level wherein we are going to fight with our own South Africans who deserve quality healthcare, because whenever they come to the hospital, they are told you must wait. We still have a long queue. And when you look at all those people who are before them, you realize they are illegal immigrants. Why they can't pay is because we can't even trace them. We can't even make them pay. They come get services. Those who are in maternity, they come give birth. Immediately when the doctor says you are discharged, they disappear and we can't trace them.